tell the jury what your opinions are about the pneumonia and Mr. Banks died from. More specific.
Yeah, I got to say, even after reading all the depositions, my original diagnosis was because this man had low white cells, he made him susceptible for a bacteria, a Pee Wee Herman bug, not an Arnold Schwarzenegger bug, but a Pee Wee Herman bug. And the autopsy, that was the only bacteria that grew. All right, and grew in both lungs. Now, so my opinion was basically unchanged. It was alpha strep pneumonia due to low white count.
And at what point do you believe that it was curable?
Well, it's, again, this bacteria is very susceptible to almost any antibiotic that covers gram-positive. Alpha strep is what we call a gram-positive bug. So any antibiotic, and it's easily killed. So as I said, by 9:30, the night before he died, he'd gone to the emergency room after the 5:30 phone call. Give him an hour or two to work him up to a chest X-ray, blood work, and get an IV in his arm, start him on antibiotics. So I would estimate they would have been done by 9:30. He'd been given antibiotics, he would have survived.
Doctor, what are your opinions about the notion that Mr. Banks had MRSA or strep B or some other type of bacteria?
There was absolutely no evidence for any of those organisms. In fact, if he had gotten, those are Arnold Schwarzenegger bugs, they would have killed him in like 4 to 8 hours. He wouldn't even lasted that long.
And what objective evidence did you use to basically buttress your opinions that it was alpha strep?
The culture's done by Dr. Gowit. Did I pronounce that right? Gowit. Gowit at autopsy. Both, he cultured the right lung and the left lung, and they both grew the same organism.
What was that?
Alpha strep.
And we'll go over that in a minute. Doctor, listen, we're going to go through some issues to educate the jury about some of the medicine. If you could tell the jury, you understand you're not a neurosurgeon, but you're a doctor. You took care of patients who had cervical spine surgery, is that correct?
Yes, so I work with back surgeons all the time.
In layman's terms, tell the jury what cervical laminoplasty is.
Well, basically you got something impinging, something pressing on the nerve, and that was giving him some arm weakness and pain and problems. So the surgeon goes in and removes bone or cartilage or disc, whatever is pressing on that, so the pressure is taken off the nerve.
Do you consider this serious neurosurgery?
Oh yeah, any slip, I mean, you're right on the spinal cord. Any slip, you're paralyzed.
Doctor, let's talk about pneumonia. We have a chart here, if you could. Your Honor, is it proper for me to get up and educate the jury?
Okay.
Do you still have the pointer?
I do. I took it home, though, but I brought it back. Lay in the pointer. Okay. Put this right here. And here's the pointer.
Yeah.
If you could, first of all, before you start pointing and talking, just tell the jury what pneumonia is.
Okay, pneumonia is an infection of the lung, and now this diagram shows first the mouth. The air will come down the trachea, and then it splits to two bronchi, and then you go to the lung. So when you lower your diaphragm, you create negative pressure, and the air flows into the lung.
Doctor, if you would tell the jury what a diaphragm is.
Oh, the diaphragm.
Let's start basic.
No, I'm sorry. Diaphragm is the muscle that moves up and down, and by moving up and down, it increases the space in your chest cavity, and that reduces the pressure in that space, so air is sucked in because the pressure is lower inside than it is outside. Okay? Now, once it gets all the way to these little air sacs. The job of the lung, remember, is two things. You want to absorb oxygen, and you want to get rid of carbon dioxide. Okay? So you have these very, very small air spaces with very thin walls, and so you have air on this side, and then in these walls you'll have an artery which can absorb the oxygen and let the carbon dioxide go out in that airspace. Now, if these air spaces fill up with bacteria and white cells, remember, the white cells are trying to kill the bacteria. They're throwing hand grenades and toxins and poisons at the bacteria, and the bacteria are throwing toxins back at the white cells. And that's what we call pus. So this pus is like your lungs fill up with fluid. So now you can't get any air to this wall where you need that exchange of oxygen and carbon dioxide. So that's what pneumonia does. So the body does not like alpha streps in the mouth, but it does not belong here. This area is supposed to be sterile. And so when something that doesn't belong there gets there, the body sends in all the white cells it can.